Good day everyone, I am Joanna IVM Ramos from BSN3 Block D, a student nurse from the College of Nursing at Nueva Ecija University of Science and Technology. For today's video, I will be performing or demonstrating the assessment of the 12 cranial nerves. For the assessment, first we should assess for the doctor's order. Next, assess for the client's level of consciousness and level of knowledge and understanding or availability and functionality of the needed materials. Next one is assess for the mental status or ability to participate in this procedure. Next, for the planning, first, if possible, determine whether screening or complete neurologic examination is indicated. This impacts the preparation of the client, equipment, and the timing. Next one, we should prepare for the equipments that we will be needing for this procedure. First is the percussion hammer, wisps of cotton to assess light touch sensation, and then sterile safety pin for the tactile discrimination, sugar, salt, lemon juice, and quinine flavors, and then the tuning fork, the percussion, the tongue depressor, and then paper clip, and lastly the pen light and clean gloves. For the implementation of the procedure, first, introduce yourself and verify the client's identity using agency protocol. Explain to the client what you are going to do, why is it necessary, and how the client can cooperate. Perform hand hygiene and observe other appropriate infection control procedures. Next one, provide for the client's privacy. And then, inquire if the client has any history of the following: presence of pain in the head, back or extremities, as well as the onset and aggravating and alleviating factors, disorientation to time, place or person, speech disorders, and history of loss of consciousness, fainting, convulsions, trauma, tingling or numbness, tremors or tics, limpings, paralysis, uncontrolled muscle movements, loss of memory or mood swings, problems with the smell, vision, taste, touch, or hearing. So to assess our 12 cranial nerves, first one is the cranial nerve number 1, the olfactory. Ask the client to close their eyes and identify different mild aromas such as coffee and vanilla. For the cranial nerves number 2, the optic, ask the client to read the Snellen chart and check visual field by confrontation. Next, the cranial nerve number 3, perla, and we should assess for the pupil retraction or reaction. Next one, for the cranial nerves number 4 and 6, the trochlear and the abducens, assess for the 6 ocular movements. Nerves number 5, the trigeminal, while the client looks upward, lightly touch the lateral sclera of the eye to elicit the blink reflex. To test the light sensation, have the client close their eyes and wipe a wisp of cotton over the client's forehead and paranasal sinuses. To test deep sensation, use alternating blunt and sharp ends of a safety pin over the same area. For the cranial nerves number 7, the facial nerve, ask the client to smile, raise the eyebrows, frown, puff out the cheeks, and close the eyes tightly. Ask the client to identify various tastes placed on the tip and side of the tongue, sugar, and salt, and identify the areas of the taste. For the cranial nerves number 8, the auditory, assess the client's ability to hear the spoken word of the vibrations or of a tuning fork. Cranial nerves number 9, the glossopharyngeal nerve. We should apply tastes on the posterior tongue for the identification. Ask the client to move their tongue from side to side and up and down. Nerves number 10, the vagus, assess with the client's speech for hoarseness. The cranial nerves number 11, the accessory, ask the clients to shrug shoulders against resistance from your hands, turn head side to side against resistance from your hand, and then repeat for the other side. Lastly, the cranial nerves number 12, hypoglossal. Ask the client to protrude a tongue at the midline and then move it from side to side. For the evaluation, evaluate the client's response to the procedure and then document their procedure and other important data on the client's chart.